Diabetes isn't just about out-of-control blood sugar numbers. Its harm goes far beyond mere metabolic imbalances. Even though many patients can manage to keep their blood sugar levels within a near-ideal range through careful management, the gradual damage occurring in the tiny blood vessels of the retina is often overlooked. Our eyes, being the windows to the world, play a crucial role in our quality of life. That's why, even when blood sugar seems stable, regular retinal examinations are essential to detect hidden dangers and protect our vision. What is diabetic retinopathy? Diabetes is a metabolic disease caused by either an inadequate secretion of insulin or the body's inability to respond to it, which in turn disrupts the metabolism of carbohydrates, fats, and proteins. As diabetes progresses, long-term high blood sugar levels can slowly damage blood vessels throughout the body, with the fragile microvasculature and the eye being especially vulnerable. Diabetic retinopathy refers to this damage in the retinal blood vessels, manifesting as leakage, blockage, bleeding, and even the growth of new, fragile vessels. It is a progressive, irreversible complication that can eventually lead to blindness. In its early stages, patients may not notice any symptoms, but by the time blurred or distorted vision appears, the condition has often advanced past the window for optimal treatment. The hidden dangers diabetes poses to your eyes. In an environment of chronically high blood sugar, the delicate balance within the retinal microvasculature is easily disrupted. Over time, the support cells and the endothelial cells lining these tiny vessels experience structural changes due to repeated exposure to high levels of glucose. This leads to cell death, thinning of the vessel walls, and an increase in vascular permeability. As a result, fluid and proteins seep out, causing localized swelling and inflammation. With the onset of local ischemia, the retina attempts to compensate by generating new blood vessels. Although these new vessels are meant to restore oxygen supply, they are extremely fragile and prone to leakage and rupture, resulting in repeated bleeding into the vitreous. In severe cases, fibrous tissue can form and pull on the retina, causing a retinal detachment. Moreover, if the damage involves the center of the retina, the macula, swelling in this region can lead to a significant drop in vision. This vicious cycle silently erodes one's visual function over time. A real-life example. Take the case of Mr. John, a 70-year-old gentleman who diligently took his medications, maintained strict blood sugar monitoring, and went for routine checkups over the past decade. However, because he neglected regular retinal exams, he never noticed any obvious changes in his vision. One day, he suddenly began to see small floaters in his field of view, along with slight distortions in his vision. Alarmed, he finally visited an ophthalmologist for a comprehensive eye exam. The results revealed multiple tiny hemorrhages and early neovascular changes in his retina, clear signs of early-stage diabetic retinopathy. Even though your eyes look normal on the surface, the doctor explained, the microscopic damage within the vessels has been accumulating for years. After undergoing laser photocoagulation therapy and receiving targeted medication, John's condition was brought under control. His case serves as a stark reminder that even if other indicators appear normal, hidden changes in the retina can be dangerously overlooked. The importance of prevention and early intervention. Modern medical research has shown that the development of diabetic retinopathy is not solely dependent on blood sugar levels. Factors such as blood pressure, cholesterol, and lifestyle habits also contribute significantly. Although keeping blood sugar within a reasonable range can help slow down the progression of retinal damage, it is by no means a guarantee against complications. A comprehensive retinal screening should be an integral part of diabetes management. In fact, some patients may already be in the early stages of retinal damage long before they experience any noticeable vision problems. Maintaining healthy sleeping habits, proper nutrition, regular exercise, and avoiding smoking and excessive alcohol are all crucial strategies for preserving retinal health. Additionally, controlling blood pressure and cholesterol is vital, as abnormalities in these can accelerate the damage to the tiny vessels in the retina. It is therefore recommended that every diabetes patient, once diagnosed, work with their doctor to set up a personalized eye examination schedule. Typically, a detailed retinal exam should be conducted once or twice in the first couple of years after diagnosis, and then at least annually thereafter, depending on the progression of the disease. Detecting abnormalities in their early stages allows for timely interventions, be it through medication or laser treatment, to help safeguard precious vision. Treatment strategies for diabetic retinopathy. Currently, there is no cure for diabetic retinopathy. However, treatment can help delay its progression and preserve the remaining vision. The main treatment methods include laser photocoagulation. This procedure uses laser energy to seal off leaking blood vessels, thereby reducing hemorrhages and the growth of abnormal new vessels. It is typically used in patients showing mild leakage. Intravitreal injections, medications that inhibit vascular endothelial growth factor, VEGF, are directly injected into the vitreous cavity. This treatment helps to suppress the formation of abnormal blood vessels and reduce leakage. Vitrectomy, in advanced cases where there is significant bleeding or tractional retinal detachment, a surgical procedure may be performed to remove the vitreous gel and repair the retina. Each treatment option has its own indications, and the choice depends on the individual's specific condition, the extent of retinal damage, and overall health. Early intervention not only delays the progression of the disease but can also substantially improve the management of macular edema and stabilize the patient's vision. Lifestyle management and the need for regular checkups. Despite the constant advances in treatment methods, prevention remains far superior to cure. A healthy lifestyle is the cornerstone of maintaining retinal health. Experts advise diabetes patients to consider the following key points. Strict blood sugar control. Even if current blood sugar readings are within the acceptable range, continuous monitoring is essential to avoid sporadic surges that can damage the microvasculature. Balanced blood pressure and cholesterol. Regularly check blood pressure and cholesterol levels to ensure that all risk factors are kept in check. Adopt a routine eye examination schedule. Never assume that clear vision means your retina is healthy. Early detection through routine exams is the best way to protect your vision. Healthy diet and regular exercise. Consume foods rich in vitamins and antioxidants, and incorporate regular physical activity to help improve overall metabolism and blood circulation. Consider the experience of Mrs. Susan, a retired teacher who managed her blood sugar quite well but had neglected her eye checkups. Last year, during a routine exam finally scheduled after a long delay, subtle leakage in her retina was discovered. Under her doctor's guidance, Susan began a strict regimen of annual retinal examinations, alongside adjustments to her diet and exercise routine. Over the following months, she noticed her vision becoming crisper and her overall health showing marked improvements. Diabetic retinopathy is a slow-progressing, insidious condition that often begins damaging the retinal microcirculation long before any overt symptoms appear. This makes regular retinal screenings indispensable, even if blood sugar levels are well controlled. With careful management, early detection, and timely treatment, it is possible to preserve valuable vision and enhance quality of life. Always remember, your eyes are not only your windows to the world but also a mirror reflecting your overall health. For individuals with diabetes, safeguarding retinal health through persistent checkups is the key to preventing blindness caused by retinopathy. Act now, partner with your doctor to protect your long-term vision, and make every eye exam an investment in a brighter, healthier future. Maintaining excellent control of blood sugar, blood pressure, and cholesterol, forged together with regular retinal examinations and a healthy lifestyle, builds a solid barrier against retinal damage. May every patient with diabetes benefit from meticulous prevention and timely treatment, and enjoy a clear, bright view of the world ahead.